Can addiction, in your opinion, be cured?
So addiction is not necessarily cured, it's treated, meaning that with the support group that you need, that is needed definitely, a sponsor working the steps, and also having a therapist, particularly with sex addiction, it can be treated.
Yep.
But cured, no, because this is an ailment for forever, because it has to deal with our mind and how it's been rewired.
What is the goal of sex addiction treatment?
So the goal basically is to deal with the unmanageability. It has to deal also with the compulsive sexual behavior. It also has to deal with the goal of being sober, learning to know what it is to have intimacy, learning what it is to deal with healthy sexuality.
And so, what does that start to look like?
As you begin treatment, the addict itself starts learning of his compulsive behavior, the patterns, his ritualization, how he got started, how it all is with starting with our belief system, how we have this impaired thinking. So we start dealing with that. So then the addict could step back and start knowing and having some type of power, I guess,
Yeah.
and learning and being conscious of his own behavior.
What experience do you have treating addiction?
So I started, like I said before, in Agape, which was inpatient or residential treatment. So with there, the women were dealing with alcohol abuse or substance abuse, such as crack cocaine, heroin. And unfortunately, at the time, some of the women were homeless. So we did have a grant with the Homeless Trust, and some of the women lost their children. So we also had a grant there at Agape with DCF. So this was really the impact of the addiction itself, of substance abuse, how it impacted them economically, how it impacted them, their family system, how it also impacted their spiritual, and how they looked at themselves.
Yeah.
So what we dealt with is giving them coping skills. We got them situated with support groups. So when they're out there, they have some type of support. We got them hooked up also with dealing with their inner child work, how the trauma of the addiction really, how it progressed,
And like
dealing with the trauma.
And like childhood trauma?
Yes.
Okay. You are a CSAT.
Yeah.
How did that happen, and when did that happen? Why did you decide to do it?
So I have this friend named Charlene, and we both worked together at South Miami Hospital. And she really was like, hey, you're already dealing with addiction. This is another addiction, which has to do with sex addiction. So it's something similar because it is still a pattern of addiction.
Yep.
And what it all stems from is trauma, obviously childhood trauma. And so she encouraged me, and I was like, okay, let's give it a shot. So about roughly 4 years ago, I have been a CSAT. I've been working in this field. I have been dealing with different individuals, from the sex addict to the spouse, to how this has impacted the family. Just like any addiction, it's never an isolated addiction. It's really dealing with the whole family and the impact of it.